The first step in advanced entry of renal trauma data is to go to the AAST MITC site and sign in. Go to the study, and then you'll correlate the subject number at the AAST with your subject number list and pick the patient. Patient should be a patient that's pending, as the person who entered the basic data should have saved this as a pending subject rather than a complete subject. So this is our current renal trauma subject. We'll go to edit this and it'll bring up the patient's record. Here's the data that's been entered by the individual that's placed the basic demographic data abstracted from the trauma registry into the record. And we'll scroll down till we get to the advanced questions. The advanced questions for renal trauma pretty much start with this section here. Did the patient develop abdominal compartment syndrome, defined by elevated intra-abdominal pressures with organ dysfunction? And these questions from here down really require some interpretation from someone familiar with trauma care and familiar with review of trauma cases. This might be a nurse practitioner, PA working on a trauma service, trauma surgeon, urologist, etc. So in this case, the patient did not. This was our previous case that we discussed in the first video, a patient that had a renal trauma secondary to blunt trauma from a mountain biking accident. The patient had angiography and also underwent embolization of a small fragment of kidney that remained. The rest of the kidney had been devascularized in the accident. So this patient did not get a abdominal compartment syndrome, but you could easily answer yes as well. How was the kidney injury first diagnosed? This was diagnosed based on a trauma CT scan with excretory delayed images to look for urine leak. And this gets to the point of whether the patients underwent this trauma scan with excretory images or whether they were subsequently done. And these are the choices. You can always check other and put in a descriptor if those choices don't capture how the diagnosis was made. In this case, we did a trauma CT scan with excretory images as the initial imaging protocol. If the patient had a renal-related intervention after admission to the trauma ward ICU, what was the reason? So this patient did have an intervention. The choices are: patient continued to hemorrhage, patient had continued urinary leak, the severity of the kidney injury needed to be treated, but the patient was not having dangerous hemorrhage. And this is exactly the category I'd put this patient in. The patient had a small area of kidney that was still viable, but the rest of the kidney injury was severe and the patient was leaking into the retroperitoneum. And so I'd kind of say this is a primary one. You could also check this one. Patient had continued urinary leakage, but the real reason they had angioembolization was the severity of the injury. And there's a number of other choices, and of course you can always check other and fill in. And I'll say small area of viable kidney was embolized to prevent urinoma. And this is very helpful to fill in some details about this. Did the patient have a follow-up CT scan? This patient did have a follow-up CT scan after their initial injury. And it'll say the date of the CT scan. The CT scan was a couple days after the initial injury. And so he was injured on the 9th. And so the follow-up CT scan was on the 11th. And was the patient still having leakage of urine from the kidney? And the answer was yes. Which kidney did the patient still have leakage of urine? If the patient had bilateral injuries, so this was the left side. How was this managed if there was still continued leakage of urine? And in this case, it was managed a little bit differently because we actually did the angioembolization of the remaining kidney. So this is a good illustration of when to use other. Typically if the patients are still leaking, then they're going to be managed with some of these other options. This case is a little bit unique. Complications or readmission. So we'll say that this patient was readmitted to illustrate this. So we'll say that the patient did have a urinary tract related complication. And this could occur during the initial hospitalization, during readmission, or identified and managed as an outpatient. In this case, we'll say that the patient was readmitted with the problem. And the date of the urinary tract complication, this patient was discharged on the April 15th, we said previously, and we'll say the patient was readmitted on the 18th for the problem. And that was the date of the complication and also the date of the readmission. What was the complication? And here are the complications during the initial admission, and there was none during the initial admission, but there are during the readmission. So during the readmission, we'll say the patient developed a perirenal abscess and came in with fevers. And we'll say that there also were positive blood cultures and there is evidence of pyelonephritis. This is the outpatient ones. And we'll say the management of the complication in this case was prolonged IV antibiotics for greater than a week. And then also a percutaneous perirenal drain was placed. We could always fill in other. So the final portion of this is just a short narrative about the injury. So this is less than 500 characters. And just fill in what exactly happened to the patient in very short narrative. So we'll say mountain bike injury, severe left kidney injury with very little viable kidney. Had urinary extravasation, embolized remaining kidney, patient readmitted with perirenal abscess and fevers, had 2 weeks IV antibiotics, and then drain was pulled. No subsequent sequelae. And so this is very helpful to us to summarize the patient's clinical course, and you can answer questions in here and put in kind of strange things about the case that are relevant to the case. So at this point you're ready to hit complete. When all the questions have been answered, then you can complete the record, and you should be able to still upload the CT scans, etc. Until all the questions are complete, it's very important that you not hit a complete, but you hit pending rather than complete. So if you have any questions and need to go back to the record, etc., then hit pending as far as the data entry, and this will save the answers that you made, but not complete the record. Once the record's been complete, you can't go back and edit the record at all. This is the end of the second tier of entry for data entry and the advanced questions for renal trauma. There'll be a subsequent video that deals with uploading of the de-identified radiology to the AAST site.